From time immemorial, long before this land we love became Texas, if you developed a serious illness or were badly injured, you had a real serious problem. Native American shamans, Spanish explorers, and padres were about the only thing around that could offer any form of treatment. Now, it's reported that the Apaches used to grind up poison ivy leaves to treat ringworm, and of course, the Native Americans had to treat fractures and gunshot wounds, but their results weren't all that good. When Cabeza de Vaca's tiny band of shipwrecked survivors waded ashore on Galveston Island in 1528, they encountered a group of hostile Karankawas with a wounded warrior. Only after de Vaca had removed an arrowhead buried deep within this warrior's chest was the group spared. Now, this may be the first surgery ever performed in Texas. From those early healers, a new breed of physician was born. Rooted in tradition, science, and compassion, they earned and held an honored place in their communities. The passion and pride that we Texans have in Texas was borne out in their work. As you look back on how far we've come in the past 150 years, it's hard to imagine what it must have been like to be a doctor in 1853.
There was a lot of hand-holding in medicine. There were no antibiotics. There were no invasive procedures. There were no hospitals.
Back in 1853, when the TMA came together, it was the recognition that there was chaos out there. Patients would go to anybody for health care. Somebody could throw a shingle up and call themselves a physician, or provide nostrums, patent medications, all sorts of stuff, and it wound up harming patients.
Well, of course, in 1853, Texas was the frontier. I mean, it wasn't just a perception. You have to realize that there were no licensing agents for physicians prior to this time. Being a member of the medical association was really tantamount to being an accredited physician.
The names of the TMA founders stand out on the pages of Texas history. Among them, Dr. Anson Jones, last president of the Republic of Texas, and Dr. Ash Bell Smith, founder of the University of Texas Medical Branch at Galveston. Those doctors saw the TMA as a way to get things done, and they didn't waste a lot of time getting started. The TMA has taken on some big battles, like supporting clean air and water, proper sanitation and hygiene, and fighting widespread epidemic disease like dysentery, yellow fever, tuberculosis, and influenza. It was the doctors of the TMA who lobbied the Texas legislature to create the Texas Department of Health. They knew that in a state as large and diverse as Texas, statewide coordination and resources would be vital. From that partnership, hundreds of innovative programs have been launched to protect, educate, and treat Texans.
One of the most wonderful things that happened in my day, and this all came about in my day in medicine, were the antibiotics. We lost so many patients back in those days that nowadays it would have been a cinch.
For the first time in my career, I saw people cured of previously totally fatal conditions like meningitis. If a doctor diagnosed bacterial meningitis, well, it was goodbye Nellie, call the undertaker. And then all of a sudden we could treat bacterial meningitis and cure people.
At the turn of the 20th century, the beginning of the 20th century, life expectancy in this country was only around 44 years. And now, 100 years later, life expectancy is up to in the mid-70s. And I can foresee that at the end of this 21st century, it'll be common for people to live more than 100 years.
I can remember sitting on the front porch shelling black-eyed peas to Ken when I was in high school, and my mother sitting there with me, and we were visiting, and it was the year before I went to college. And she said, "Ruth, you have this idea that you want to be a doctor." She says, "I've never seen a woman doctor, and I have no idea what your life will be like if you persist. But in this great country of ours, I feel that if you persist, doors will open for you."
So when I came to Texas, we still had all of the signs up saying water fountains, white only, colored only, restrooms were segregated. But guess what? Sick people are not segregated. When they get sick, they accept help from wherever it comes. And I gave that help. I continue to give that help. And consequently, I have not had any problems having people accept the help that I have to give them.
If you're going to practice medicine, you cannot be an individual, a solo practitioner, and do well. You need behind you an organizational strength, not only to advise you about things that you don't know about, but also to represent you before the legislature and before government and before insurance companies. And the Texas Medical Association is the only, not only the best, but the only organization that can do that for you in Texas.
Having all the doctors together, thinking about where medicine came from and where medicine is going and all the challenges that we have in our profession. Individually, we will be able to make a difference, but it is not until we get all together and think together that we will be able to make a tremendous difference in the way we practice medicine, and that will benefit our patients.
TMA has always been an active organization, and activism works. We've worked with business groups, consumer groups, the legislature, and many other groups, all with one goal: the ultimate care of the patient and putting the patient first.
As we know, Texas Medical Association is the strongest medical association in the United States. They have given us the authority or the credibility that physicians on a local level need. When TMA backs a cause, you know the rest of the United States is going to listen to you.
The TMA speaks for us. The TMA speaks for medicine. The TMA speaks for the well-being of our communities, not only along the border, but the whole state of Texas. And the TMA speaks for health. That's as simple as it can be, and that's what they ought to be involved in.
I think a telling time about the relationship between TMA and TDH is what happened on September 11th, 2001, a day that none of us will ever forget. Before the sun set, TDH, working with TMA, had sent an advisory to physicians in Texas, alerting them to the possibility that people might present in their offices with signs and symptoms that may be attributable to bioterroristic agents.
Major crisis right now is liability, and then, to my way of thinking, the next one is the socioeconomic aspects. Without both of those getting better in the next few years, we're going to lose a lot of doctors, and patients will lose access to not only primary care, but to specialists, and the quality of life and the length of life in Texas is probably going to go down. The only way that this can be accomplished is by being a group, and that group is the TMA.
My father made enough money, but he didn't make very much money. But he wasn't concerned about it. The bottom line was not what was important to him. What was important to him is what his patients thought about it. And we've changed. But we've changed not because doctors have changed necessarily. It's because the patients have changed, because the advances in technology, and because the funding system's changed. And so it's no one's fault, it's an evolution. And someone who was very bright 50 years ago could have predicted this, that someday the technology would pass our ability to pay for it.
The profession of medicine hasn't changed over the years. It is the periphery of medicine, the regulation of medicine, that has changed. For those people who want to help mankind, who enjoy people, and want to do something for people, medicine is the place, one of the greatest places to be.
It's been incredible to me. I mean, you come into medicine, and when you start medical school, it's strictly learning the sciences and learning the practice of medicine, but you don't understand the grand scheme of things, exactly what the concept of practicing medicine in this healthcare environment is. When you get involved with organized medicine and the mentoring you get from some of the physician leaders we have within this organization, that is truly what helps you understand what practicing medicine really is.
Texas Medical Association has been called the best medical society in the country. It all gets back to core values. Our core values don't change. Ethics, education, quality, a dedication to what's best for patients, that is always there. What changes are the issues: payment, regulation, tobacco lawsuits, anything we can address, because it all ties back to that set of core values which don't change. And that gives us our strength, and that's our springboard to address any issue that might affect doctors and their ability to provide the highest kind and quality of care the patients at Texas expect.
I think what amounts to immortality is what you can leave for others to carry on and keep alive, because you can't keep it alive. Your time here is limited, but you can give others the concept. In other words, you can give the torch to others to keep the light burning.
I guess if I had a hope or a dream, it would be that Texas physicians would lead the way to the marriage of high-tech, high-touch medicine. We must be the finest scientists that ever lived in order to bring to patients what modern technology has helped create. But if we don't continue to do it in a fashion that says the individual we're caring for is ultimately more important than any science in or outside the room, then we lose something. So if Texas can lead the way in providing and teaching high-tech, high-touch medicine, then I would be the proudest physician you can imagine.
Whether it be the physician that accompanied Cabeza de Vaca across the plains of Texas and treated the wounded Indian chief, or the physician that treated the yellow fever epidemic on the banks of the Colorado River, or the physician that today battles the plague of HIV, or those physicians that are colonists or members of the space station expeditions in the future. The common thread is the caring and compassion those physicians have for their patients. That noble thread is forever.
Texas medicine has come a long way since that chilly January morning 150 years ago. Those doctors knew they needed a voice, a strong voice, to represent them in the fight against ignorance and greed. The Texas Medical Association is that voice, providing education, guidance, and support, fighting to improve the health of Texans in every corner of this great state. Our future is every bit as uncertain as was TMA's founders. New technologies, new techniques, new diseases, new threats, and always new opportunities are right around the corner. But despite all our progress, we still confront many of the same villains, the same threats, and the same challenges. Based on the hard work of the earlier generations of Texas physicians, the Texas Medical Association today represents the best hope of bringing to reality the vision of quality health care for all Texans. Our support and our participation gives renewed life to the visions, hopes, and dreams of those who preceded us. Just like those old doctors of the prairie of yesteryear, there's always a new challenge right over the next hill. No question, we've come a long way and seen a lot of milestones in the last 150 years. And together, we have a lot of miles left to travel in our never-ending, never-wavering journey of the heart.